Hey guys, we finally have some good news for Social Security, and I am so happy to say that because it feels like lately it has just been a constant bombardment of bad news. So I'm very excited to lead with some good news here today. Now, of course, I do have to tell you there is some not so great news that we're going to talk about later, but that's going to come later. For now, I want to focus on the good stuff. Just make sure you don't go anywhere. So first up, we're going to talk about clawbacks. Now, I know clawbacks are not a happy thing. But the good news is that Social Security has recently announced they're going to be dropping that default overpayment recovery rate back down to 50%. Now, I know that the idea of losing half of your check to this is not happy, but it's better than what they were doing before, which is taking the entire thing. For those of you who are new here or who haven't heard us discuss this before, the Social Security overpayment recovery rate is something that they use if the Social Security Administration feels like you've been overpaid. And it could be your fault or it could be their fault. It doesn't really matter. If you get more money than you're supposed to, they're going to try to take that back. And when that happens, we call that an overpayment recovery. So that's what's going on with that. Now, for those of you who find this a little too familiar, it's because they keep changing this on us, right? We keep talking about this over and over again on this channel, primarily because we're just getting constant whiplash from the changes in these numbers. So in March of 2024, you can see here, they dropped it down to 10%. And they had a lot of good reasons for doing that because we were seeing a lot of seniors and people with disabilities who are getting these absurd repayment orders for, $40,000, $20,000, $80,000, in some cases over $100,000 from these little mistakes that added up over time. And and those repayment letters and the demands and the stopping of checks was causing people to lose their housing, to be unable to purchase their medications. It was wrecking a lot of lives. So in March of 2024, they dropped that repayment rate to 10%. And they basically said, hey, if you've been overpaid, we're going to take 10% of your check. You can keep the other 90%, and we'll just get that money back over time. Well, in March of 2025, they undid that and went back to that 100% repayment rate and basically said, if you owe us money, we're not giving you any more. And they just started keeping all of the checks, which is catastrophic, right? If you rely on Social Security to survive and that money just stops, that is absolutely catastrophic for your budget. So that's what we announced last. And that happened just a few weeks ago. And then just today, I saw the news come in that on April 25th of 2025, they sent out this emergency memo to their employees and said that they are going to start capping that default rate at 50%. Which, I mean, I'm calling it good news because half is better than all, but it is kind of sad that this is what passes for good news nowadays. I'm not gonna argue that it's not great to lose half of your check, but it is certainly better than losing all of it. So, just to preempt some of the conversation that I'm sure is happening in the chat right now, every time I talk about these, I hear from people who say something to the effect of, well, if you were getting overpaid, you should know about it, and that's on you, and all of that. But that's not actually how this works. Because a lot of times people have no idea they're being overpaid because they were overpaid from the beginning, right? We're not talking about people who just suddenly got a $10,000 check out of the blue and we're like, hey, cool, that's mine. That's not what's happening here. We're talking about mistakes, maybe even made by the Social Security Administration, that resulted in someone always getting more than they were supposed to. And in a lot of cases, not substantially more, maybe $50, $100 a month more, that added up over time and then was eventually caught. And now there's an absurd sum of money owed. So in one of the sources I reviewed today, it looks like it was CBS News, they said the agency's inspector general found that 73,000 overpayments in 2022 were due to problems with the Social Security's own calculations rather than the fault of the beneficiary. So the person receiving the money did absolutely nothing wrong in these cases. This was something that went wrong at the Social Security Administration that the person receiving the benefits is now going to have to pay back, potentially by losing half or all of their check. So you can see why this is such a significant problem. And hopefully that helps you understand why some people, honest to goodness, have no idea until they get the demand letter. Now, I also found some other interesting information here. It says that many overpayments affect disabled workers who rely on SSDI and receive an average of $1,538 per month. So this is primarily affecting SSDI, it looks like. And here's another statistic that I thought was really interesting. About one third of Social Security recipients rely on Social Security for 75% or more of their income. I'm curious to know if that applies to you. So if you want to drop a quick yes or no in the chat and just let me know. I imagine that one third is pretty representative of our audience here at Low Income Relief. And that's why I care so much about this recovery rate and these clawbacks, and why I always come and tell you about them as soon as they change, because I can't stand the thought of any of you losing your check out of the blue, or even losing half of your check, or honestly, even 10% of your check, because I know how much every dollar means to you. And that is just an awful situation to be in. So just to quickly go over this next bit, because we've covered this before, you need to make sure your address is up to date with the Social Security Administration, because the way they communicate about these overpayments is through the mail. You need to keep an eye on your mailbox, make sure you're checking your letters, and you just read everything that comes from Social Security just to be safe. If you do get a notice about an overpayment, you need to respond right away. You have options. You can appeal it, you can request a reconsideration, you can negotiate what percentage of your check they're going to take, but you have to act within a certain time frame. The emergency memo said, quote, "If the individual does not request a lower rate of withholding, reconsideration, or waiver after the approximately 90-day period, we will recover the overpayment by withholding up to 50% of their Title II benefit payment if there is no fraud or similar fault until we have fully recovered the overpayment," end quote. Now, I wanted to read that to you because the other comment that I always get when I bring this up is people saying, "Oh, well, we shouldn't have any tolerance for fraud." If they think it's fraud, they're not negotiating this. There's not waivers if you're accused of fraud. That's a whole separate process. This is for people who either made an innocent mistake or honestly didn't make a mistake, but Social Security did. So just to be clear that that's what we're talking about. So they are not saying why they made this adjustment. But what we do know is that the Senate recently confirmed Frank Bisignano as the new Social Security Administration Commissioner. And one of the things that he had said in his Senate interview was, quote, "I'm going to make sure that we recover all the money we should recover, but on the other hand, we have to be humans in the process too." So I don't know, maybe he had some influence over the change that happened. It was before he was confirmed, but I'm glad to see that they are being a little bit more human in that process and softening that recovery repayment rate. Some other things I saw from his interview as he was being confirmed, this was all reported by NBC Philadelphia. He said that he did not intend to privatize Social Security, which is something I've seen brought up a lot in our comments lately. He said, "I've never thought about privatizing. It's not a word that anybody's ever talked to me about. I don't see this institution as anything other than a government agency that gets run for the American public." So that is comforting. Some of the priorities that he described included reducing the error rate, which would help prevent those overpayment clawbacks, improving the wait times both for calls and claims. I did see some talk of integrating AI into the Social Security phone lines to help shorten those times. I don't think I worked it into the slides, but one of the things I saw as I was researching this today was that only 46% of the phone calls to Social Security actually get answered. And that is heckin' alarming, I think. They said that it's probably because people get frustrated and hung up. But I know from the comments on one of our previous videos that some of you have waited on hold for 5, 6, 7, 8 hours and still never had your call answered, which is insane. So hopefully he'll succeed in bringing those call times down. I don't know how you feel about having AI answer your Social Security calls, but I'd be interested in hearing your opinions on that in the comments or here in the chat. I know I have mixed feelings about some AI integrations that I've seen, and I'd love to know how you feel about it. When asked about Doge and all of that, he said that he would protect personally identifiable information, which is at least comforting because we are seeing that there is a massive push to get a hold of that information that Social Security has. And there is a whole lot of sensitive information in that database that goes far beyond your Social Security number, right? We're talking about work histories and disability histories and medical histories and so on. So protecting that personal information, I think, is a really important priority for a Social Security commissioner to have right now. Let's see, we've got lots more news today, so don't go anywhere. But first, I want to talk to you about something else I saw. If you're interested in Social Security, of course, you're probably interested in Medicare as well. The DOJ recently filed a lawsuit against 3 national health insurance companies and 3 brokers for engaging in unlawful clickbacks and discriminatory behavior, specifically discrimination against people with disabilities. So basically what happened here, and this is a press release, you can go check that out if you want, but basically what happened is they're suing some of the biggest insurance companies, Aetna, Anthem, Humana, I guess Anthem is now Elevance. Anyway, they're suing them along with 3 big insurance brokers, eHealth, GoHealth, and SelectQuote. I've heard of all of those. I don't know if you guys have. But basically what they're saying is that the insurance companies paid the brokers to push certain plans, which is fairly common, but they did it in a way that was not best for patients, right? So the brokers are accused of selling the plans based on money, not medical needs. In fact, there was some information in here about how they would refuse to sell plans that weren't paying enough. And one of the things that was really concerning in here is that they conspired to turn disabled people away because they weren't profitable enough, which is a terrible thing, right? So that lawsuit is ongoing. Now, this is all just my personal opinion here, but if you worked with any of those companies, this would be a really good time to call our partner chapter Medicare and see what actual best Medicare plan is for you. You can always call them for free Medicare advice. I trust them. I think that they're great. You can see their phone number here, or I think they only answer during business hours, and I'm a little late getting this video out today, so you may have better luck if you just go take their survey. Just take a quick survey and then you can connect with them that way too. But if you worked with any of the companies that were involved in this disaster of a lawsuit, I would double check just to make sure you're on this plan for your needs. And the best way to do that, in my experience and opinion, is to call chapter. I trust these guys. I refer everybody to them, even my family. So with that, let's go ahead and move on. To some other Social Security news here. Now, you're going to see a lot of these headlines about people that are being cut from Social Security, right? People love to make these headlines because they get clicks. And usually when I see a headline like this, it's something like, oh, well, people aged out of, the dependence program, or, just different, like, normal procedural things that are being portrayed as headlines. But this one got my attention, and I saw this reported in a few different places. But they are proposing a ban that would stop payments for around 170,000 beneficiaries. But what's happening is they want to stop people who do not have Social Security numbers from acting as representative payees. These are people who receive the money for someone else, right? So some situations where someone who doesn't have a Social Security number may be a representative payee could include an immigrant parent who is receiving benefits on behalf of an eligible child, or widows or beneficiaries of eligible workers who live overseas. They might not have Social Security numbers, so those could all be stopped if this proposal moves forward. Right now, it does look like this is still just a proposal, though, and nothing is set in stone here, but I wanted to bring that to your attention. If you are still waiting on funds from the Social Security Fairness Act, then that money should be coming to you by early November. Around 80% of seniors and people, around 80% of seniors who were affected by the Fairness Act should have already received their payments. But there's still close to 1 million people who are waiting for that money. And based on what I read, it sounds like they did everything that they could do on an automated basis. And now the more complicated cases that require more manual processing are now being handled that way. But it is going to take a little bit longer. But they did say that that money should be sent out by early November. So if you're still waiting, it shouldn't be too much longer, hopefully, before you're able to receive that. And the back date the back pay should still be retroactive. So when it does come in, that all should be there for you. All right, what else do we got? Oh, this is fun. I would really love to hear your opinions on this one because I keep going back and forth and I can't figure out how I feel about this. So they have announced that starting this summer, Social Security will let people access their Social Security numbers digitally. They say this will be helpful if you've lost your card or you can't remember your number or something like that. So you'll be able to log in through your My SSA account and display your Social Security number on a device for identity purposes. It sounds like you're supposed to be able to use that the same way that you would use a Social Security card that you would carry with you. They're hoping that this will help ease the burden of replacing cards that are lost or stolen. I'm sure that this is just as much about their convenience as ours, because I think a lot of the calls and the appointments that they deal with are replacing those cards, and they're probably hoping to cut that down by doing this. That being said, I know plenty of people who are not going to be really thrilled about having their Social Security number available in this way because, concerns about theft and what have you. So I found this really interesting. Not that this is comforting, because it's really not. But apparently, most Americans' Social Security numbers have already been breached because of all of the different data breaches and things that have happened. That information is already out there. That's why I personally love Delete Me. I didn't put their information on screen today, but if you go to lirlinks.com/DM, then you should be able to access my 20% discount on Delete Me from that sponsor. I use them because they delete all my information everywhere that they can find it. My phone number, my addresses, all that information that people use for verification. So if you're interested in a service like that, you can go check that out. But anyway, data breaches are so stressful to me. It's like I've had death threats from my job, so I do not love my information being out there. But that is a conversation for another day. And I guess that brings us to the end of all news that I had for you today. Thank you for sticking with me. I really appreciate it. I'm getting a headache from my studio lighting in here, so I'm not going to be able to take a Q&A today, unfortunately. I will answer one question from our last video, though, that I noticed, and that was, where am I? And the answer to that is I am at my desk. This is unfortunately a green screen. I wish that my space looked like that, but alas, it does not. So that is just a green screen backdrop so that you guys don't have to see the mess that is my actual life. But I appreciate you. I know in the last live that I did, I was going through a really hard time, and I was I know I apologized for some things, and we talked about some kind of heavy stuff last time, and I just wanted to tell you guys that your comments made my day. You guys are wonderful, and I'm so glad that you're here. And I hope you do have a wonderful day, and I will talk to you again soon.